Human resource managers are in the business of making positive connections. They're employed by companies and government agencies to match people to jobs.
Hi, Viviana, how are you? Good to see you. Come on in. Can I have a seat, please?
That means these managers work both to attract qualified job candidates and to keep them satisfied once they're hired. So they develop recruiting and training programs, personnel policies, and in larger companies, they might oversee hiring and firing in several departments.
Our new approach around medical costs.
A career in human resources begins with college, with an emphasis on business, behavioral sciences such as psychology, communications, or liberal arts.
Lee, hi, how are you?
Hi, Chip.
Good to see you.
To become a manager, you might work your way up through a human resources department. There could be a fair amount of travel involved, especially if you're involved in recruiting on campuses or going to conferences. Ultimately, though, this is a comfortable office-based career with fairly predictable 9 to 5 hours and the possibility of good benefits. You must be able to speak and write effectively and be sensitive to other people's perspectives and needs. A good human resources manager plays a vital role in the morale and success of a large organization.
Most of us take breathing for granted, but not everyone is that fortunate. Because of an accident or illness, some people need assistance to breathe. They may rely on respiratory therapists. These professionals have gone to college for at least an associate's degree to learn about respiratory illnesses, conditions that affect the lungs, such as asthma and emphysema. Therapists also learn how to treat people who are having trouble breathing because of an injury or stroke. Struggling to breathe can be frightening, so a calm, reassuring manner is essential. That includes taking the time to clearly explain procedures and answer questions.
We're going to put you on this machine. This machine is going to help you breathe, okay?
Using a ventilator and breathing tube, the therapist delivers oxygen to a patient's lungs. They usually work under a doctor's supervision in hospitals and clinics, although some therapists visit patients through home care services. It's not unusual to work nights and weekends and spend a lot of time standing and bending. Tanks can be heavy, and because gas under high pressure can be hazardous, you must handle them with care. Much of this work can also be done by respiratory technicians. But because they have more limited responsibilities than therapists, the job of technician is being phased out. With America's population aging, it's expected that more therapists will be needed in the years ahead. So this field offers good job opportunities. Many people are able to breathe easier, knowing they're in the care of trained respiratory therapists.
To accomplish the everyday miracles of modern care for heart patients, it takes a team of professionals. Cardiovascular technologists and technicians are essential members of that team.
Okay, Mariana, everything looks good.
Technologists are trained to prepare patients and assist physicians during procedures such as cardiac catheterization, balloon angioplasty, and open heart surgery. They also monitor patients' blood pressure and heart rate. The intricacy of these operations requires a high degree of precision and concentration. The work of technicians focuses on the measurement of the electrical signals generated by the heart, called an electrocardiogram, or EKG. Technicians place sensors on the patient and then use one of several machines designed to provide physicians with a printed record of the heart's beating. They may also administer stress tests. Diagnosis and treatment of heart and blood vessel disease depends on the careful work of these professionals who are trained at hospitals and community colleges.
According to this, the left was normal, the circumflex was normal.
EKG technicians may also be trained on the job. People wanting to go into these occupations must be reliable, have mechanical aptitude, and be able to follow detailed directions. The ability to put patients at ease is a definite asset. The work can be stressful, but very rewarding, because every hour of every day, someone's life is on the line.
Looking inside the human body without resorting to highly invasive surgery is the work of radiologic technologists and technicians. They use equipment such as X-rays, CAT scans, or computerized tomography to help prepare patients for tests and treatments. The technician is responsible for properly positioning and immobilizing the patient on the examining table. Sometimes they administer non-radioactive materials into a patient's bloodstream for diagnostic purposes. This can be done orally or by injection.
Okay, you'll be done shortly.
Technicians monitor the video display of the area being scanned, adjusting controls to improve picture quality. Some technologists operate equipment themselves, or they may oversee a radiologic staff, assigning duties and supervising the work. They may work with the facility's administration to develop operating budgets and to help in deciding what new equipment to buy. Technologists work with infectious and radioactive materials. They are responsible for ensuring that radiation safety measures comply with government regulations.
Okay, you can breathe.
Training in this field ranges from 1 to 4 years. This is a profession with better than average growth. With a large aging population, demand for diagnostic imaging will increase.
Hold on. Yes. Hi, I'm Rosanna. I'm going to be taking your assessments, right? Okay.
Not to be overlooked is the importance of the human side to the job. These procedures can appear scary, especially to children and the elderly. A friendly, reassuring manner is almost as important as technical expertise.